Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we're starting off the week here with Nate. And Nate is a local Houstonian here who has suffered from pretty significant herniated disc in the lower cervical spine for 6 years or more.
6 years or more.
Yeah, and you've been to see 4 different chiropractors, and you've had the quote-unquote spinal decompression machines that I just call glorified traction machines.
Yes.
And you said that gave you relief for what? How many seconds?
About 15 seconds of relief.
15 seconds of relief.
30 minutes after.
For how much?
Pain all would come back. Well, whatever they can get my insurance.
Whatever they can get, huh?
Yeah.
Okay. So, this is Nate's first visit here at Advanced Chiropractic Relief. I've already done his orthopedic neurological examination, and surprisingly enough, he is 5x5 strength in the upper extremity, and he's got 2+ equal and active reflexes in his upper extremity, in the biceps, brachioradialis, and the triceps muscle. But I did find significant vertebral subluxations in his spine, from his cervical spine all the way down to his pelvis, which is the SI joint. But one area I did find that was super tight was his lower thoracic spine, which is a transition zone between the thoracic kyphosis and the lumbar lordosis. Now, Nate's a mail carrier, and you've been doing that for 20 years, right? So his job requires him to look down a lot, which reverses the cervical curve and puts more stress in that thoracolumbar area. So let's come over here, and I'm going to have you on your knees on this table for me, please, sir. Face all the way up in here. Slide down just, there you go. Good. Now let this spine drop just with gravity. Oh yeah. Good job. That was deep. You ever had that adjustment before?
Oh, sir.
Okay, let's go on your tummy here. Yeah, that'll get your ribs you were talking about. I adjusted the lower thoracic, upper lumbar spine with that one. Now his left leg's 1/2 inch shorter in the prone position, and it gets 1/2 inch longer whenever I bring it up, and that tightens up in his low back and pelvis and thighs. So he's positive Knockless and Deerfield test. I did a sacral deviation test on him. Go ahead and lift that right leg up, please. See, it's hard for him to get that right leg up. Try the same thing on the left one now. See the difference? The right leg didn't come up near as far. He does have a right sacral deviation, so that's where I'm going to get started adjusting him. In his right sacrum. Straight superior to inferior, as well as P to A. Posterior to anterior. My contact is the right superior aspect of the sacrum. Now I'm adjusting his right SI joint. Now the SI joint doesn't move a lot, okay? So I'm moving it in the line of the joint itself through the P to A axis and Z axis. That's why I don't do the side adjusting postures, because your SI joints don't move that much. So if you're stretching those SI joints out, doing that kickstart like a Harley-Davidson adjustment, oftentimes it will sprain the sacroiliac ligament, which is the big ligament that has the largest surface of any other joint. The sacroiliac joint does, with the ilium and the sacrum, therefore sacroiliac joint. So you notice I always adjust the SI joints along the planes of the joint itself, which is like a 45-degree angle obliquely, and just his middle sacrum straight superior to inferior. Now here's the big one. There's L5. Some of these will be a little sore at first, Nate. There's L4, L3, L2. There we go. Okay, now I've already adjusted T12 there. Okay. Let me get one more here. I still feel one. Yep. Okay, you're going to feel your head popping up a little on this one, Nate. Now I'm going to get the curve going back forward in your neck, because yours has started reversing. one right there. That one was tender, wasn't it?
Yes, sir.
Let's turn you on your back, please, sir.
Yeah, I felt that.
Yeah, I knew you would. I'm just getting started, too. Good. Now slide down this way a little bit, please, sir. Let's put your arms straight out like that. So adjusting your shoulders, your AC joints, your clavicles here where they attach to your sternum, sternoclavicular joints, and then into your ribs here. Because he had misalignments in the costovertebral joints, which is the vertebra and the ribs. He's also got costosternal subluxations up here. Okay, relax your hands on your tummy for a moment for me, please, Nate. Let this relax. There you go. Boy, I should have felt that one from your knee all the way up to your lower back.
That felt good.
Yes, sir. There you go. Feel that one the same?
Yes, sir.
Let's sit you up, face that way, please, sir. And you see Nate's a fellow Harley-Davidson rider. There's your right shoulder. Oh yeah, crack addict's gonna love you. You became a crack addict on there watching our YouTube videos too, didn't you?
I just wanted
So to
that.
speak.
I wanted that relief.
Yeah. Did you see everybody else getting?
Yes.
Uh-huh. Well, it's fixing to come. There you go. Okay, good. All right, there's a big difference between those machines that are called spinal decompression devices, which I think are just glorified traction machines, and what I do, which is an actual adjustment. Let's go ahead and put your butt there. Head up this way, please, sir. My ring dinger adjustment is just that. It's an adjustment from the occiput all the way down to the sacrum. I'm fixing his iliac crest in here so that I've got good levers. And then I'm gonna wrap this wet towel around his occiput and his mandible. Keep your teeth together for me, Nate. Just breathe through your nose. Yes, sir. And remember, he's got 2 large herniated discs in his lower cervical spine. Good. Okay, Nate. Let me have you here. Yes, sir. I got you. That's it. Now, was that different than the other 4 chiropractors adjustments you had?
Oh, yeah. That wasn't put on the side, that's for sure.
No, sir. Okay, let's kind of get up sideways and stand here in front of the mirror for me, right here. All right, I'm going to have you flex your head forward and backwards, and remember how this feels. I see that's still pulling a little bit. That's still kinking a little bit, but it's better than it was. So I'm putting a little bit of a P to A high velocity, low amplitude thrust with my Atlas specific adjusting instrument. Now I'm going to stretch his muscles out here. I'm going to bounce the muscle spindles, which affects the Golgi tendon apparatus, and will reset these muscle spindles in his traps, levator scapula, and rhomboid muscles. You see your trap goes all the way down to here and attaches into your lower thoracic. Okay, now pull these shoulders up and back. This is your homework right here. This is going to counteract that forwardness. So you don't want to just tilt your head back. You want to bring it straight back in the Z-axis first, and then look backwards as far as you can. I'm going to push it a little bit. Squeeze those shoulders together for me. There you go. Good. Okay. Now, Nate, I'd like for you to relax and bend your head forward and backwards again. Wow. Did you feel the difference on that one?
Yes.
How did it feel after I did that instrument on you?
A lot looser, not as tight.
Smoother?
Not as tight on this side.
Okay.
Which is good.
Do you feel lighter right now?
Yes.
Good.
I feel flexible.
Well, this is your very first time getting the manual spinal decompression done versus the traction machines that you talked about, decompression devices in the past. What can you tell our YouTube audience about how this feels compared to having that traction machine?
The traction machine, it's a slight pull, which feels like it relieves tension.
Mm-hmm.
With that, I felt my whole neck just crack.
Mm-hmm.
I mean, I felt the pull.
Release, yeah.
And after that,
decompress.
After that, I didn't feel any numbness. Or
oh, your numbness easing off?
No, I didn't feel anything. I mean, it just
okay.
Felt like
a normal neck for once.
Yes, it felt totally different.
So how do you feel right now versus when you walked in the door?
I don't feel like I'm walking tense or anything. I feel like
You feel some relief?
I actually feel like I can just go jog or something.
Oh, good on your heart. It's more fun than jogging.
Not in
well,
this
thank
traffic.
you for sharing your experience. I agree with you.
Yeah.
Houston's a dangerous place to ride a
Yes.
motorcycle. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief with some hardcore chiropractic. This is a severe cervical disc herniation which has not responded to multiple other providers' care, and we adjust the spine and extremities pure and simple here. That's what makes us hardcore chiropractic. We'll see y'all soon.